Hello again, I'm Dr. Herman here on hopeforyourcancer.com, and there's always information in the news coming up. Some of it you may not hear on television, or maybe you get a little blip of it and you just say, well, unfortunate for that person, but you've got to understand certain things that are going on out there in the healthcare world and what's available for you, and sometimes you're not told this information, and you deserve to know it. And let's understand about somebody that you probably are. If you live in the U.S., you've seen this show, Good Morning America. If you live elsewhere in the world, maybe you've seen it, maybe you haven't. But there's a former host on Good Morning America. Her name is Robin Roberts, and here's the title of this article that's on the internet. Robin Roberts' cancer cure may have caused her new illness, and she'll need more of the same therapy. Wait, I want to read that again because that's a little confusing. Robin Roberts' cancer cure may have caused her new illness, and she'll need more of the same therapy. If one therapy caused an illness, why use it to try to cure that illness? That doesn't make sense to me. So let's read on. Chemotherapy, as an expert says, the only way we know how to get rid of those damaged cells. So if you look this up online, New York Daily News, type in Robin Roberts cancer, New York Daily News, you could read that article. But on the next screen here, I want to share with you other research that's out there that tells you about the disease that she now has to deal with, caused by the chemo drugs to help her, try to help her fight the cancer. Okay. And this came off of Wikipedia. And this is the disease that she has now, after beating breast cancer. It's called MDS, is the name of the disease. Myelodysplastic syndrome. MDS, formerly known as pre-leukemia, are a diverse collection of blood-related medical conditions that involve ineffective production of a certain class of blood cells. Patients with MDS often develop severe anemia, and the problem with severe anemia is your body needs iron levels to be normal for the iron, which is like a taxi cab to carry oxygen to all of your tissues. And when you have low oxygen in tissues, what happens to a cell? It can become cancerous, or cancer can thrive there, let's put it that way. So patients with MDS, or myelodysplastic syndromes, often develop severe anemia and require frequent blood transfusions. In most cases, the disease worsens and the patient develops low blood counts. What do we need to fight cancer and keep us alive? We need white blood cell counts. We need normal hemoglobin levels. We need normal, not low blood counts, due to a progressive bone marrow failure. And that's what they want to do, is offer her now a bone marrow transplant, which can be devastating and may have to take immunosuppressive medications, because bone marrow transplant, sometimes the body doesn't take, and then they got to be on immunosuppressive, and that leads to other disease growth in the body. So now it's turning into a vicious cycle, is how it sounds to me. And hopefully for her sake I'm wrong, or hopefully for her sake she finds somebody who knows how to do something else for her. Maybe in addition to what she's doing, or whatever she chooses, and her family as well. So where were we here? So patients with MDS get anemia, need blood transfusions, they develop low blood counts due to progressive bone marrow failure. In about 1/3 of these patients with MDS, the disease transforms into leukemia, usually within months to a few years. The myelodysplastic syndromes are all disorders of the stem cell in the bone marrow. So the chemotherapy caused her body not to be able to make its own healthy blood cells again. Unfortunate for her. The myelodysplastic syndromes are all disorders of stem cells. In MDS, blood production is disorderly and ineffective. The number and quality of blood-forming cells declines irreversibly, further impairing blood production. So let's go back 1 second here. They said that her cancer cure, her breast cancer cure, may have caused her new illness, and she'll need more of the same therapy. And what are we reading here? That therapy caused something that can lead to leukemia. It's causing bone marrow suppression and causing blood cell irreversible damage, but they want to use the same therapy to treat her. And before Roberts undergoes, now let's get back to the article from New York Daily News, and before Roberts undergoes a bone marrow transplant to combat the MDS, or myelodysplastic syndrome, they will need to subject her already weakened body to even more chemotherapy. She doesn't need to do that. That is what they are telling her to do. If they lose her, and hopefully it doesn't happen to her and her family, but if they lose her, they still get to go home to their family and their kids and go on vacations, and she doesn't. If she gets sick and needs constant blood transfusions and constant work forever, I mean, you know, it almost gets to the point of what's the point of living? So I can't speak for her. She has her own decisions to make out there. I know it seems counterintuitive, says Dr. Raza, who heads the MDS Center at New York Presbyterian Hospital, but this is the only way we know how to get rid of these damaged cells before we can start treatment. That's brilliant. MDS is the disease of the blood and bone marrow that, if left untreated, can lead to leukemia and death. So, but the therapy caused it in the first place, and now they want to use it again. I mean, hopefully you're following along with what I'm telling you here. It is a relatively rare condition, said Raza. There are about 15 cases diagnosed annually every year in the U.S. Are they doing anything for her to help her body get stronger? Is there anything offered to this woman in respect to that? Patients who have been exposed to benzene, which you'll find benzene in cigarette smoke, you'll find benzene in certain, that's studying organic chemistry. I did that for 4 years when I was in college, and I taught that in college. Benzene rings are damaging to your system, and it's found in a lot of different products that you think are safe for you because companies can sell it to you over television, that you're supposed to be able to have fragrances and colognes and things to clean up germs and bacteria that are so bad for you on your counters and so on. So, besides cigarettes. Patients who have been exposed to benzene or who have undergone chemotherapy or radiation treatments for cancer are the most susceptible to MDS. Sometimes stem cells are damaged during radiation or chemotherapy. And the doctor said this, MDS is a bad disease to have. So on the article, and you can go read that, it says that they want to try with their sister to do bone marrow transplant, but again, they're going to have to use immunosuppressive, which is already suppressed, and I pray for her that she will be able to come around, and that would be an awesome miracle if they can do that work for her. And then maybe I'm just speaking, and they're brilliant, and I sure hope that it happens for her that way, where she finds somebody who can also offer her some other things to integrate to help herself overcome this serious life-threatening disease. But one point of this video is keep your eyes open and ears open and look for information out there. But look for information for you to help yourself, a family, a friend, or somebody you don't even know who needs to know that there's other things available for them out there, that there are other options, that there are certain causes of their disease in the first place, and it's all here on this website. I work night and day to get you research. I travel throughout the country to meet with different doctors who are doing amazing work, and you deserve to know. So again, look around on our website at hopeforyourcancer.com, and hopefully we get to meet with you and your family, and I look forward to helping you. Thank you very much.